Let's talk about what options there are for patients even after, let's say, a dual antibody combination and TDM1 already. What would be the traditional options prior to the recent FDA approvals, and what kinds of outcomes would you have expected until recently?
Well, lapatinib with capecitabine was in there in the approval, although I think over time it's been pushed back. Virtually all of the recently approved drugs have proven to be better than lapatinib with capecitabine, with or without trastuzumab. We also frequently reuse trastuzumab in combination with other chemo agents, and have shown if a patient's already had a taxane with HER2 antibodies, that you can go third, fourth line with other chemo agents that have proven to be safe and have synergy with trastuzumab. So I think that was also commonly maybe a third line approach after the combined trastuz, pertuz, first line, and then TDM1. But now we've got, several new agents with efficacy, and we don't know which to use in what order, and are we going to move them up earlier? There was an interesting abstract submitted to ASCO 2020 that came out of the Japanese group that just looked at, after patients' tumors had progressed on TDM1, what was being used in the real world. And at that time, it was before the metastatic neratinib approval, tucatinib, or the trastuzumab deruxtecan approval. And it was exactly a mishmash of everything. Switching out the chemo with trastuzumab, continuing pertuzumab, sometimes beyond as well, adding lapatinib and capecitabine. But that's already out of date. We've got a whole bunch of other active agents that are much more exciting than those choices. And I think we're starting to prescribe them, and need more help in terms of knowing which tumors and which patients should get which of these drugs that are very efficacious in what order.